Hi, it's Dr. Ogwin again. And in the last video, what I did is explain a little bit about what chiropractic has to offer. In this video, I had mentioned I wanted to get a little bit more in depth about a spinal adjustment, a chiropractic adjustment, what it has to offer and what it can do for people in pain. So we had mentioned before, and we had got out this model of the spine, and I had talked about how tension, restrictions, or misalignments anywhere along this chain will throw off proper biomechanics. People that have this tension or restrictions usually have an increased risk for pain and for injuries. And what we want to do is restore that balance, restore the proper biomechanics. So I look at the way people move, I palpate the musculature, I palpate the joints, and put that balance back into the spinal column and make sure that everything is moving the way that it should be moving. The second component of an adjustment is going to be pain relief. What they have found through research is that in the joints and in the soft tissues that surround the joints, there's what's called mechanoreceptors. You can stimulate these mechanoreceptors, which are nothing more than nerve endings. Just you touch somebody and you're stimulating particular receptors, that information gets sent up into the brain and into the central nervous system, where the mechanoreceptors are stimulated by pressure and by motion. A chiropractic adjustment, doing some of the trigger point therapy that we do with the muscles, the myofascial release, all of those are going to stimulate these mechanoreceptors. It sends information into the spinal cord to block pain. It also sends information up into the brain to release endorphins and enkephalins. And as a lot of people know, these are the feel-good chemicals. After those are released, you have this feeling of euphoria. You feel very good. People get off the table after an adjustment, after treatment, many times, and they have immediate pain relief. The third component is going to be neurological. There's a man by the name of Stuart McGill. He's a back specialist, and he studied the adjustments, and what he likes to call it is a restart for the central nervous system. So the way that we explain this is just as your computer gets slow, it gets bogged down, the processor isn't functioning properly, you restart the computer and it kind of resets everything. With the same thing with an adjustment, what they have found is that it resets the muscle patterns that surround those joints, and it acts as a restart for the central nervous system. So to recap, we have three components of the adjustment. One is the biomechanical. We put balance back into the spine. 2, pain relief. We stimulate those mechanoreceptors and now people are out of pain. 3, neurological. It almost acts as a restart for the central nervous system and resets the muscle pattern that surrounds those joints. And if you have any question, there is a screen that will be popping up here in a moment, and it will have all of the contact information. Please feel free to contact us with any questions.